Good evening, everybody. I don't think I've ever gone live on my Facebook page. I think I always go on my personal page. So last night, for those of you that are tuning in, my name is Rachel from Find Your Worth Fitness, and last night I went live on my personal page about polycystic ovarian syndrome, or PCOS, and what my journey through it, like how I found out that I had it. So I'm doing a short series because I really want to spread some awareness to help women become advocates, be an advocate for women who have PCOS, create a little support in our community. So tonight I'm going over some signs and symptoms that you may have polycystic ovarian syndrome. I touched a little last night that PCOS mimics some other autoimmune disorders like celiac disease and hypothyroidism. So you know, they're caused by inflammation, so that's for another video though. But I wanted to go over some signs and symptoms. As you guys hop on, say hi. So the most common, I think, sign or symptom of PCOS is irregular periods. Because you're getting cysts in your ovaries. It's a hormonal imbalance for those of you that don't know. It causes excessive male hormones in your body, but it causes irregular periods. Infertility is a huge one. I struggled with secondhand infertility, and infertility is probably one of the roughest ones to go through, depending on who you talk to, of course. Acne is a big one. Adult acne. I struggled with adult acne for years. Thankfully, I have found something that works for me. Excessive weight gain, especially around your midsection. The thing with the weight gain in polycystic ovarian syndrome, though, is that not everyone that has PCOS will have weight gain, but it is a sign and symptom. I have friends of mine that have PCOS, and they're thin. You would never know that they had it. You can't tell by looking at somebody. Depression. Moodiness, high blood pressure is another one, excessive facial hair and body hair, but then thinning of your hair on your head. So I don't know if you can see it, and this is a little personal, but I always get chin hair. Yeah, it sucks. So excessive facial hair is a sign of it. Sexual dysfunction, or like decreased libido, decreased libido. That's a tongue twister for me. Sleep apnea, dry patches on your skin, skin tags, pelvic pain, fatigue. They call it a silent disease because you can't tell from the outside that you have PCOS, and when you have it, people I think that it doesn't really affect you, really. It's just a hormonal imbalance, but your hormones affect everything. So when you have a hormonal imbalance, it's kind of a big deal, it affects everything. So on average, it takes 2 years to be diagnosed with PCOS, and on average, it takes 3 doctors to actually figure out and diagnose you for the average woman. And that comes from the Journal of Clinical Endocrinology and Metabolism. The onset usually occurs between 11, around the time you hit puberty, but most women don't find out until they're in between 11 and 20 years old. I'm going to talk about the risk factors also tonight. The risk factors are kind of scary. It causes insulin resistance, which is why you gain weight around the midsection, which it causes diabetes. Women who have PCOS are more likely to get Hashimoto's and hypothyroidism, which are both thyroid disorders. You're more likely to have metabolic syndrome and heart disease. It causes stroke, and when you're older, because of the hormonal imbalance, your bones become weak, so you can get osteoporosis. And endometrial cancer or ovarian cancer. It also, when you're pregnant, if you get pregnant, because a lot of women struggle with infertility, just because you have PCOS does not mean you're going to be infertile and you're not going to have kids, but it does cause infertility. When I got pregnant, I had 2 out of these 3 things. It causes gestational diabetes. It can cause preeclampsia and preterm labor. And I had gestational diabetes and I had preeclampsia. And this last one for me with being pregnant was a huge, like, it was emotional. As I was doing my research for this, I was like, they lie, like, they didn't, when you talk to doctors and people who don't know about PCOS, they tell you, no, it doesn't affect that, it doesn't affect that, but it does. So it's still a newish, it's not something a lot of people know about, a lot of doctors know about. So we're still learning, they're still learning. So, when I had Lily, back to pregnancy and what it causes, I tried everything to nurse. I wanted more than anything to nurse her. And I, after about a week and a half of trying to nurse, went back to the lactation consultant, and they weighed her, and then I nursed, and then they weighed her again, and she did not gain an ounce. So they said, you need to supplement. She's not eating. So I started supplementing. I was nursing for about 20 minutes on each side. Then I would feed her a bottle and then pump. My mom tried to FaceTime me, of course, right in the middle of that. So I was nursing and then bottle feeding, supplementing her because she wasn't getting anything, and then pumping. And they just kept saying, pump and feed her like you normally would. Your milk supply will come in. It just hasn't come in yet. And I did that for about 6.5 weeks before I became so mentally exhausted and physically drained, I could not do it anymore. I couldn't. So I stopped. I was devastated. They said it might be because I had to have a C-section and she was underneath the oxygen hood when she was born. And she didn't latch on properly at first because of that, because she had to have IVs. So they said it was because of that. So then a year and a half later, 20 months later, I had Hunter. And he was, pro. Latched on, great. And the same thing, I didn't produce. I felt like, I said last night, I felt like a failure. And they kept saying, at this time I didn't know I had PCOS, but they kept saying, just continue, nursing and pumping, and it'll come in. And it never did. So then I had Dylan last year, and at this time, when I got pregnant, I had lost 30 pounds before I got pregnant. I tried to stay pretty healthy during my pregnancy. I gained about 35 pounds. I tried to stay pretty healthy, though, and at this time, I knew that I had PCOS, so I knew I had this hormonal imbalance. I knew that I typically don't produce milk, so I was trying everything that I could do in my power to produce breast milk. And so my friend Bryn gave me this lactation cookie recipe, and it was so good. So I, about a week before I had to have my C-section, started baking and eating all the lactation cookies. And I was also drinking mother's milk tea. So I have Dylan, and I cried, real tears, when he started nursing. And when I started pumping and milk was coming out. And it was literally like this much, even after like a week. But I was like, oh my God, it's here, I've got milk. I was so excited. So I said to my lactation consultant, hey, I have polycystic ovarian syndrome, and I could never produce milk, and it's a hormonal imbalance. Could this be why? And no, that has nothing to do with it. You can produce milk, you just need to keep doing it. Well, she was wrong. Hormones affect everything. They affect your milk supply, and it does lower your breast milk supply. So for me, I nursed Dylan, and I had to supplement. Took him to the doctors. It took him 3 weeks. We were in the hospital. I had him on I think it was Tuesday. I had him on Tuesday, and I didn't get released until Saturday. We had to stay a little extra because he wasn't gaining weight. He had lost so much weight and then he wasn't gaining weight. So it took him 3 weeks to get back up to birth weight with supplementing. So I nursed until I went back to work at 12 weeks, but I was also supplementing. So don't be afraid to supplement. That's kind of like, went off on a tangent on that one. But PCOS, as you can tell, as you know, it really affects women. A lot of it you don't see, you don't know about unless they speak about. So that's why I'm speaking out about it. I'm trying to be an advocate for women who have it. I'm trying to inform and educate people to see, you know, because a lot of women don't know they have it. So if you think that you have it, I recommend going to a doctor. And if you know someone who has it, be supportive. I want to know your guys' feedback. If you have PCOS, what is something that you would want everyone to know about? And if you don't have PCOS, what is one question you could ask a woman with PCOS? So, it's been great talking to you guys this evening. Have a beautiful evening. Bye.